Good day everyone, I'm Noemi Ann Ferlino from VSHM 1A, and for today's video I am going to tackle about the mental health in the COVID-19 pandemic. So let's start! So first, we have the content and discussion muna. So first we have the prospectus, terminology, aspiration, psychological reactions to pandemic, authentication, and data of mental health problems during the events of COVID-19 pandemic, psychological impacts, and also we have their references. So in the prospectus, during any outbreak of an infectious disease, the population's psychological reactions play a critical role in shaping both the spread of disease and the occurrence of emotional distress and social disorder during and after the outbreak. Despite this fact, sufficient resources are typically not provided to manage and pandemic's effects on mental health and well-being. While this might be understandable in acute phase of an outbreak, when health systems prioritize testing, reducing transmission, and critical patient care, psychological and psychiatric needs should not be overlooked during any phase of pandemic management. So what is COVID-19? Coronavirus disease 2019 or COVID-19 is a contagious disease caused by a virus, the severe acute respiratory syndrome coronavirus 2 or SARS-CoV. The first known case was identified in Wuhan, China in December 2019. The disease spread worldwide, leading to the COVID-19 pandemic. So what's the aspiration here? To recognize the significance of mental health in COVID-19 pandemic. So, psychological reactions to pandemic. So there are many reasons for this. It is known that psychological factors play an important role in adherence to public health measures such as vaccination, di ba? And in how people cope with the threat of infection and consequent losses. These are clearly crucial issues to consider in the management of any infectious disease, including COVID-19. So the psychological reactions to pandemics include maladaptive behaviors, emotional distress, and also we have the defensive responses. So in the authentication of data of mental health problems in the events during the pandemic COVID-19, one study of 1,210 respondents from 194 cities in China in January and February 2020 found that 54% of respondents rated the psychological impact of the COVID-19 outbreak as moderate or severe. 29% reported moderate to severe anxiety symptoms, and 17% reported moderate to severe depressive symptoms. Notwithstanding possible response bias, these are very high proportions, and it is likely that some people are at even greater risk. During the 2009 influenza outbreak or the swine flu, a study of mental health patients found that children and patients with neurotic and somatoform disorders were significantly overrepresented among those expressing moderate or severe concerns. Against this background, and as the COVID-19 pandemic continues to spread around the world, we hypothesize a number of psychological impacts that merit consideration now rather than later. In the first instance, it should be recognized that even in the normal course of events, people with established mental illness have a lower life expectancy and poorer physical health outcomes than the general population. As a result, People with pre-existing mental health and substance use disorders will be at least risk of infection with COVID-19, increased risk of having problems accessing testing and treatment, and increased risk of negative physical and psychological effects stemming from the pandemic. Second, we anticipate a, a considerable increase in anxiety and depressive symptoms among people who do not have pre-existing mental health conditions, with some experiencing post-traumatic stress disorder in due course. There is already evidence that this possibility has been under-recognized in China during the current pandemic. Third, it can be anticipated that health and social care professionals will be at a particular risk of psychological symptoms, especially if they work in public health, primary care, emergency services, emergency departments, and intensive or critical care. The World Health Organization has formally recognized this risk to healthcare workers, so more needs to be done to manage anxiety and stress in this group, and in the longer term, help prevent burnout, depression, and post-traumatic stress disorder. So, in the hypothesis, the steps to limit the psychological psychiatric effects of the COVID-19 pandemic. First, while it might be ostensibly attractive to redeploy mental health professionals to work in other areas of, this should be avoided. Such as move would almost certainly worsen outcomes overall healthcare and place people with mental illness and disproportionate risks of deteriorations in physical and mental health. If anything, this group needs enhanced care and this time. Second, we recommend the provision of targeted psychological interventions for communities affected by COVID-19, particularly supports for people at high risk of psychological morbidity, enhance awareness and diagnosis of mental disorders, especially in primary care and emergency departments, and improve access to psychological interventions, especially those delivered online and through smartphone technologies. These measures can help diminish or prevent future psychiatric morbidity. And finally, there is a need for particular focus on frontline workers, including but not limited to healthcare staff. In the USA, the Centers for Disease Control and Prevention offer valuable advice for healthcare workers in order to reduce secondary traumatic stress reactions, including increase awareness of symptoms, taking breaks from work, engaging in self-care, taking breaks from media coverage, and asking for help. This kind of advice needs to be underpinned by awareness of this risk among employers, enhanced peer support, and practical assistance for healthcare workers who find themselves exhausted, stressed, and feeling excessive personal responsibility for clinical outcomes during what appears to be the largest pandemic of our times. Even in this emergency circumstance, or especially in the emergency circumstance, we neglect mental health at our peril and to our long-term determined treatment. So, psychological well-being care for everyone. This one. Lastly, we have the references. First, we have the Taylor S. and Psychological of Pandemics. Second, the Wang C. Pan or Wang X and so on. Third, the Page L.A. and so on. Fourth, the Rogers and Dalton G. Harden and so on. Fifth, the Duan L. Zhu and so on. Six, the World Health Organization. Seven, the WHOCY. Eight, the Centers for Disease Control and Prevention. So, thank you for listening. I hope its help. And if you do any questions, you can email me and fnoemi@gmail.com. So that's all for today. Thank you. Have a great day.